As the country heads into its first lockdown-free spring since the pandemic began, COVID too is having a revival.
What's the bird eating?
And for people like Constance, who has a suppressed immune system, higher case rates make her worry whenever she leaves home.
I have definitely curtailed where I visit, when I visit. I think we're getting forgotten. I'm a young mum with a family that depends on me. You know, I matter.
In Scotland, COVID infections have hit a new record high, with 1 in 14 people estimated to have had the virus in the past week. The figure's the same in Northern Ireland, while in England it's now 1 in 20 and in Wales 1 in 25. And that rise in cases is impacting on hospitals, where more than 14,500 people are now receiving medical care. That's around a third of the peak in January last year. And in Somerset, doctors warn that already poses a challenge.
We see pressures due to the numbers of patients that are currently admitted, both with COVID and with other conditions. And it is a challenge to make sure our infection control is as precise and all-encompassing as possible.
But thanks to the vaccine, the number of people getting severe disease or dying is much lower than it was. And ITV News understands that from next week, vaccine centres like this will be offering a 4th dose of the jab to people over the age of 75, those living in care homes and those who are vulnerable. Some experts are warning, though, that now isn't the time to stop offering free COVID tests for all, which are due to be scrapped in England in 2 weeks' time.
I think it's difficult. We didn't want to be where we were now. If you look back a few months ago, it seemed reasonable to scale down the testing. I'm not saying we should test at the level that we always have, but I think removing all asymptomatic testing is challenging at the current time.
And the question is how much we're willing to allow COVID to spread as people continue to enjoy their new lease of life. Hannah Miller, News at 10.